Infrared radiation in electrotherapy. Infrared radiation is a form of electromagnetic radiation used in electrotherapy for superficial heating of tissue. It lies between visible light and microwaves in the electromagnetic spectrum. Infrared therapy is commonly used in physiotherapy to relieve pain, improve circulation, reduce muscle spasm, and promote healing. Infrared therapy works mainly through thermal effects produced by absorption of radiation in superficial tissue, skin and subcutaneous tissue up to 1 to 2 cm depth. Wavelength and parameters. Wavelength range 700 nanometer to 1 millimeter. Therapeutic range 700 nanometer to 15,000 nanometer. Frequency 3 into 10 to the power 11, 4 into 10 to the 14 Hz. Penetration depth. Short infrared radiation up to 1 to 2 cm. Long infrared radiation mostly absorbed superficially. Epidermis. Types based on wavelength. Near infrared radiation IRA 700 to 1400 nanometer. Mild infrared IRB 1400 to 2000 nanometer. Far infrared IRC 3000 to 1 millimeter. Types of infrared generators. Non-luminous dark generators emits long wavelength infrared radiation, not visible light, produce mild uniform heating. Example ceramic infrared heaters. Luminous generator emits short wavelength infrared radiation, produce visible red glow, higher intensity heat. Example tungsten filament lamp. Comparison luminous versus non-luminous. Feature wavelength. Luminous have short, non-luminous have long. Visible light. Luminous have present, non-luminous has absent. Heat intensity. Luminous has higher, non-luminous has moderate. Penetration. Luminous has slightly deeper, non-luminous has superficial. Heating area. Luminous have localized, non-luminous has wider. Production of infrared radiation. Infrared is produced when electric current passes through tungsten filament. Filament is heated to high temperature, emits infrared radiation for visible light. Resistance wire embedded in ceramic material, non-luminous, emits long wave infrared. Physiological effect. Local temperature rise, increase skin temperature 40 to 45 degrees Celsius, vasodilation due to release of histamine like substance causes arrhythmia, redness, increase blood flow, improve oxygen and nutrition supply, increase metabolism, speed up tissue repair, reduce muscle spasm, decrease muscle spindle activity, pain relief through gate control mechanism and removal of metabolism, increase sweating. Therapeutic effects. Pain reduction, muscle relaxation, reduce of joint stiffness, improve tissue healing, preparation before stretching or mobilization. Treatment parameter. Distance 40 to 75 depending on the intensity. Angle 90 degree to the treatment area. Duration 10 to 20 minutes. Intensity comfortable warmth. Frequency once daily or alternative days. Doses based on patient sensation: mild warmth, acute condition, moderate warmth, subacute condition, strong warmth, chronic condition. Arrhythmia grading: E1 mild redness, E2 moderate redness, E3 intense redness, E4 burn or avoid. Indication with patient example: osteoarthritis. Example 60-year-old patient with knee osteoarthritis, infrared before exercise to reduce stiffness. Chronic low back pain, example office worker with muscle spasm, infrared for 50 minutes prior to stretching. Muscle spasm, example athlete with hamstring tightness, infrared before proprioceptive neuromuscular facilitation stretching. Chronic sinusitis, applied over sinus region with eye protection, post immobilization stiffness. Contraindication: absolute, improved sensation, malignancy, active bleeding, acute inflammation, severe circulatory disorders, over eyes, thrombophlebitis. Relative contraindication: elderly with fragile skin, cardiac patient, fever, metal implants. Caution. Precaution: always check thermal sensation before treatment. Protect eye both patient and therapist. Do not allow patient to sleep. Maintain proper distance. Inspect skin every 5 minutes. Avoid wet skin. Remove metallic object. Test equipment before use. Clinical examples: Case 1, frozen shoulder, 45 years old female with stage 2 adhesive capsulitis, Infrared radiation 15 minutes followed by immobilization and stretching, improved range of motion and reduced pain. Case 2 chronic cervical spondylosis. 50-year-old teacher infrared radiation for 20 minutes, isometric neck exercise, reduced stiffness. Advantages: simple and inexpensive, easy to apply, good for superficial heating, safe if used properly. Limitation: limited depth penetration, risk of burn, not suitable for acute inflammatory stage, cannot treat deep joint effectively.